Welcome to The Hanley Effect, a podcast by the Hanley Foundation designed to educate, change minds, and save lives. Our goal is to inspire you, showcase our innovations, and change the conversation about addiction and mental health. Join us as we unravel stories of resilience, recovery, and hope.
Whether it's recovering from addiction, trauma, mental health challenges, or any other life obstacles, this podcast is your safe space for inspiration, guidance, and real stories of triumph. My name's Cory, and today I'm joined by the CEO of the Hanley Foundation, Dr. Rachel Docekal. Rachel, always great to see you.
Hey, Cory.
So addiction, it's a general topic we're going to talk about today, but it really touches on every generation. And I know Hanley Foundation does a spectacular job with older adults.
We do. We in fact, innovated older adult treatment. Did you know that?
I did not know that.
Okay. So we had an amazing staffer, Carol Colleran, and she, about 20 years ago, recognized that when older adults and individuals who were younger or maybe of active adult or middle age status were together, what happened was a number of things, but primarily the parent-child relationship kicked in and people assumed roles instead of focusing on their own recovery. What she did was carved out those older adults, looked at the generational differences, and certainly we all have generational differences with folks who are younger and older than we are. There's been so much study about that. She found that when individuals of the same generation were together, they were able to really empathize with each other. They came from the same type of background, so they had the same pressures, they had the same thoughts, many times the same values, and ultimately their outcomes and treatment were better.
It's pretty amazing considering that the baby boomers are quickly becoming those older adults and that World War II generation is dying off. So we can see, though, that addiction is not just for older adults, it touches everyone.
It does.
So today, we're going to be joined by Dr. John Dyben because we know that Americans spend billions of dollars treating addiction every year, and the impact, as Rachel mentioned, is not just older adults, it's individuals, families, and communities. Dr. Dyben is the Chief of Research and Innovation at Hanley Foundation and brings a wealth of experience and expertise to the forefront of addiction science and care. He has a deep-rooted commitment to advancing evidence-based best practices and is paving the way for Hanley to strive to create a world free of addiction. Lofty goals, Mr. Dyben. Thank you so much for joining us, John.
Thanks, Cory, for having me. Appreciate it.
John, one of my favorite people on the planet. So for those of you who are listening out there, I'm sure you could tell that Cory was reading off of his script.
That was not ad-lib.
No, not ad-lib. We have the Cory TV voice, which I love. Dr. D, which is what I call him, is incredible. John, talk about just a little bit about your background at Hanley, if you would. You have had almost every job.
It's been a great journey. So next month, in a few weeks, it'll be 20 years that I've been here. You know, they say really messed up people either go into ministry or psychology. And I did both. That's right. So my dual diagnosis is that I'm both clergy and clinician. My initial background, I started my career as I thought I was going to be a pastor in church ministry all my life. But I really loved counseling. I actually got my initial clinical training in seminary. And I did work on staff at a church and had a counseling center there and found pretty quickly that that was not really where my life was supposed to be spent. And so I left vocational church ministry and I went into children's mental health. I worked for Boys Town, Father Flanagan's Boys Town. Some people are familiar with it.
Incredible.
It really is my alma mater clinically. I think of it that way. I really got some of the best training in my life. I always said the one thing I'll never do in clinical work is adult addiction. I was very clear I was never going to do that.
20 years later?
More than, yeah. But I actually came here when I was working for Boys Town. I ended up running some programs and different things. And I came to a point in my life where I really wanted to get back to direct care. And there's a lot of long stories, but somebody who, there was a very large spiritual care department here at Hanley, and I was introduced to the director, and he said, come be a chaplain. And that's someone who has both a clinical background and a theological background. And I'd never considered it, but I came here to to do that. And so I spent the first 3, 4, 5 years here just working with patients and helping people find healing. And I love that. And over the years, Hanley Center for me has been, it's a home. It's very much my home. It's very much integrated into who I am. And so a long time ago, I got a message, go where you're asked to go where you're needed. And so I was chaplain for a time, and then I was needed to be the clinical director and chief clinical officer and run some different programs. And so I've run a lot of different things, had a lot of different positions here. But about 10 years ago, I really started to I'd been doing this work for a while. I'd been seeing successes, and I'd been seeing people who relapsed, and I've been seeing people who lived and people who died. And I really started to look at what is it that makes a difference. And I was introduced to the study of epidemiology and public health, and this idea that whatever health conditions we have, whether it's addiction or cancer or diabetes or whatever it is, that it is more than just the individual that has a determining role in how people do. And so, I went back to Nova, I got my doctorate in health science, and really have had for the past decade, though I am still a therapist, I still love doing treatment and I love doing supervision. And I really have a passion for understanding how the multitude of what we call the social determinants of health. So it's how does illness affect not only the individual, but the family, and then the larger family, and then the community. And also how does the community and our society and our family affect diseases? So currently, I've been given this really cool opportunity to head research.
And innovation.
Research and innovation.
Let's not forget the innovation.
It is really important because we have, I think, in mental health and specifically in addiction treatment, we have not done a great job. We talk about treating the disease of addiction. We've known since the 50s, the American Medical Association said alcoholism was a disease. We've understood it as a disease, but we have not held ourselves to the same rigorous standards of innovation and research that we expect of people who are treating cancer, diabetes, or other conditions. And so I get now, it's kind of one of the most fun things I've done. I get to do all the things I love, all those other things of being a chaplain and being a therapist and being a supervisor, but I also really have now the opportunity to truly spend time with other researchers and professionals and say, how can we better understand this condition and how can we innovate so that we actually make a difference in addiction and mental health in our country?
Cory, this is our first of a series of podcasts. The piece that John just touched on that I'm super excited about is we are going to use this forum to talk about those innovations and the way that Hanley Foundation is changing the face of behavioral health and the societal approach to behavioral health. It's interesting. Right before this, I was saying to John that the way that many centers still treat addiction is akin to that old joke. Doctor, it hurts when I do this. And the doctor says, well, then don't do that.
Right.
That really doesn't get to the root cause. And you're right. The patient is the family. The family is the patient. But the family is the community is the society. And how do we change this approach to behavioral health? In a way, it's the way we approached AIDS treatment back when AIDS started to come on the scene. People were shunned. There was stigma. Right. People didn't want to talk about it. It seemed like we could stereotype individuals who had AIDS, same thing with individuals with substance use disorders. None of that is accurate. None of that is accurate. And until we draw a line in the sand and change what we are doing as a society, we are not going to be able to gain on this disease. We are starting to draw that line.
Yep. That's so well said. That parallel with AIDS, if you look at the curve of AIDS cases and people of deaths, you know, and you'll see like there's this really specific change in that. It got worse and worse and worse and worse and worse and worse and worse. And there's a really, really specific change where you could see it getting better and better and better and better and fewer and fewer and fewer people dying. And so what's really interesting is what in the world happened at the peak of that curve? What made that change? And the change was not, people will talk about, there's a lot of different drugs and there's a lot of, the change
Those innovations were later. They were later.
Exactly right. And the only reason they came about was because of a societal shift. So when a couple of things happened, first of all, some people that the population really liked, like athletes and wonderful stars, ended up coming out and saying, I have AIDS. And that began to humanize it to people. And then it's right around the time where Hollywood actually began, you would start to see TV shows and some really important movies that humanized it. And our culture changed. And so we went from saying, don't fund AIDS research. We don't care about those people to, wow, they're human beings. Let's fund it. Let's,
and people who are beloved.
Yes.
They are people who are beloved.
That's right. So it's such a perfect example because it is the whole system changing that is required. Anybody who knows me has heard the story 1,000 times, but I was taking a class on global epidemiology. I'll never forget this.
For those of you who haven't figured it out yet, John is a major nerd. We lean into the nerddom here. We love it.
I'm such a nerd. But when I was doing this, I had to study this disease called dracunculiasis.
Well, explain what that is.
So dracunculiasis.
That was not part of Cory's
I don't want to date that person.
Is also right. It's also known as guinea worm disease. Now, anybody can look it up, and it's interesting. It doesn't really. What matters is this: that for centuries, millions of people every year were affected with this disease that had a devastating effect. It was a parasitic worm, and it would make them unable to work. And these are people in third world countries, millions of new cases every year. What the disease is doesn't matter. What matters is that in 2021, the number of new cases in the world, I think, was 5.
Wow.
So what struck me was, oh my gosh, there is in our history a condition that affected millions of people devastatingly every year that now is almost eradicated from the earth. What the heck happened? And what I learned is that this guy named Jimmy Carter and his wife, Rosalind, were over in Africa and they learned about this disease. They got a burr in their saddle and they said, we're going to put everything we can into figuring out how to change this. And what they did is they applied what's called the epidemiological triad. What they said is, we're not just going to change individual people. We've got to look at 3 things. And it's an old model, but it still works today. You've got to look at the agent. We need to understand what the disease is. So that's what Dr. Volkov and NIDA are doing great work on understanding what addiction is, how it works in the brain.
In the brain. That's the part we got to listen to. In the brain. This is not something where people are acting in a way that they shouldn't act. This is a brain thing.
It is a neurobiological condition. Every major health organization has got that clearly defined. So you've got to understand the agent, the disease. You got to understand the host. How does it affect the person? And so that's those things like there is a more than 90% correlation between addiction and trauma. And so if we're not addressing trauma, if we're not looking at the whole person, their psychology, their spirituality, all of that, and then finally you got to look at the environment.
That's the biggie, the environment.
So what I love about what you said is you drew that wonderful example to AIDS, and right away I went back to the visual on the National Mall of the quilt, and when Magic Johnson came out, and those people went from being pariahs.
I remember where I was when Magic Johnson came out with that announcement. That's how powerful that was.
Right. And not just you. Everybody listening. All the millions of people listening right now.
Paradigm shift in a second.
In a second. And if you think about how they were pariahs to now Elton John hosts a party after the Oscars with the money going to age treatments. But the question I want to come back to is what Rachel hit on is the brain and the disease of the brain. And you were talking about everything that goes around that, treating the family, the community. How do you do that while also getting them to confront the trauma?
But the piece, I'm going to do a pop in here, is using that old saying, it's the brain, stupid, or I forget the root of that. But it's not. It's actually the cake that's baked from those three elements that you talked about, those three elements. And that's one of the reasons why opiates were able to be so devastating.
That's right.
Because somebody put their thumb on the scale with saying, oh, this is okay to take. This is not something that's addictive. That is really the defining moment that led to the crisis that, is better, but that we are still dealing with now. So we can talk about the brain, but we got to talk about it with the other two elements at the same time.
I couldn't agree more. In fact, I think that that's the reason I love talking about the brain, because we talk about stigma. So stigma is when somebody has a negative prejudgment towards a person or a group of people. And so there's a lot of stigma, negative judgment towards people with addiction. And the idea is that these people should be able to just stop doing that.
Or they have no moral compass.
They're just weak, right? I've had to learn to step myself back from this and pause for a second, because I realize how devastating stigma is. Stigma keeps people from treatment. Stigma keeps politicians from putting money into research. But also, look, people have stigma often because they've been hurt. If someone lies to me and steals from me, if someone says they'll do something, says they'll show up and they don't, if someone I love is hurting themselves and won't stop, the normal human experience is to feel anger, to develop some negative feelings. But if I can understand what's happening, and so when we talk about the brain, the whole reason really to do that is to help people understand what they're looking at so that they can let go of some of that judgment. You're right. You can't just have one without the other.
You're right. Let me just tell an anecdote here. It turned out okay. I'll lead with that. My older daughter, Caroline, we call her Carly. She is brilliant and delicious in so many ways. When she was, I think, 17, she had 3 impacted wisdom teeth. We got a referral to an oral surgeon. We went to that oral surgeon, and as we were going through the paperwork, the oral surgeon said, I'm going to give you a prescription for opiates. And I said, no, thank you. I would prefer some other type of pain relief or management, the better word. And the physician said, no, you don't understand. The pain is going to be so much that she really is going to need these opiates. So, just take this and get it filled. And I said again, I'm pretty assertive. No.
What?
Stop it.
No, thank you. But let's talk about some other means of controlling this pain. Should we use ice? Should we, what should we do? So this doctor, he developed an attitude that was really off-putting. I felt bullied and, but I stood my ground. We went out to the car. My daughter and I went out to the car. I opened up this folder of information that told us when to be at the hospital and all of those different things. And don't you know, he had inserted this prescription with a sticky note that said, addressed to my husband, who he hadn't even met, this really needs to be filled.
Oh, wow.
Yes, a Post-it note on there. And I mean, wow.
Did we find another dentist?
It was wrong on so many levels. We did not fill that prescription. My daughter had successful surgery. She did have pain. We managed it other ways. Mm-hmm. And my kid's brain was not exposed to opiates. But I've been doing this work with Hanley Foundation since 2010 in some form or fashion. I am a pretty educated consumer. Other people who maybe don't have the ability to say, this is what I know, or they have that feeling that anything that their physician says is gospel. Right. I mean, this could have gone wrong on so many levels. Here's the last thing I want to say. This prescription was for 30 pills.
Wow.
30 pills. Enough to get 3 people or more addicted to opiates if taken regularly. So just a side note for our listeners, do not flush that medication down the toilet.
Right.
Please do not flush that medication down the toilet.
Bring it to your pharmacy.
Bring it to your pharmacy. You can certainly drop it off here at Hanley. We're at 933 45th Street. But the pharmacy is really the best place to take it. There's one on almost every corner, and they know how to dispose of it properly so it doesn't show up in our water system.
But your stories are both, I mean, anybody listening, right? And we could all have stories like this. The key is that though everybody is impacted, everybody's brain is impacted by drugs to some level or another, that some people have a genetic predisposition to develop a disease.
Doesn't mean they will.
That's right. We live in a very substance using and even substance abusing country. You know, the majority of Americans fall into substance use, whether it's alcohol or other drugs. And then some people have what's called the old terminology. We would talk about abuse. We've changed our terminology, but I think it still makes sense. Bottom line is sometimes it doesn't cause any problem in people's lives. Sometimes it causes problems in people's lives. But some people, because of their genetics and just the way their brain works, are going to develop a disease called addiction. And here's what's important about it and why it is important that we talk about it as a neurobiological disease, as a disease of the brain. The best illustration that I have for it is when I think of my father. So my father is still alive today. He's a former fighter pilot, engineer, a scientist. He is A, the most moral human being I've ever met in my life. B, obviously, fighter pilot, military, he's a tough guy. Scientist, he's bright. So he's got morals, very religious guy, very intelligent guy, strong guy, all those things. And he told me a story. He was a fighter pilot in Vietnam. And the story was, before I went to Vietnam, we had to go through jungle survival training. And as part of this, I had to go through this ungodly amount of time without any liquids, 60 plus hours. Basically what happened is they bring you to the point where you're dying of thirst, right? Literally. And he said, what I learned about myself at that moment, this man was already engineer, fighter pilot, tough, smart, moral, religious. But he says, I would have done anything to anyone at that moment to get water. And that is true of any of us who end up in a life or death situation. So if any one of us in this room finds ourselves in a situation where we are starving to death, we will lie, we will cheat, we will steal, we will hurt people.
Sounds like the plot of a very successful musical called Les Miserables.
Interestingly enough, I read the actual book at 15. Don't recommend it, but anyway. The reality is that's exactly right. And that's not about moral weakness. It's not about intellectual weakness.
It's about the brain.
It's about the brain. So when we end up in a survival state, the blood flow and essentially what happens is the part of our brain that has I have a friend who's a neuropsychologist. He hates it when I say this, but I call it the moral centers, right? It's the part of our brain that says, I want to do something that is wrong, but I stop myself and I do what is right anyway. Impulse control. And that's the prefrontal cortex. call that the moral center to a neuropsychologist. They don't like it. But it's kind of where my control is. My instinct is more midbrain. What happens when we're in a life and death situation is our brain, the blood flow and the energy goes to that midbrain. And so we're in instinct. A person who is in active addiction, a person who has the disease, we can see this now, thanks to Dr. Volkov and others, that literally there is less blood flow. That prefrontal cortex, that impulse control area, the part that is what I call the moral centers, they kind of go offline. And so a person with an addiction is not making a choice to continue using any more than a starving to death person would be making a choice to be driven to food. Your brain literally goes into a survival state. And the more, and this is a gross simplification, but the more we can help people understand this and understand what's happening.
Or the family and the community understand this.
I gave this talk in a little more detail to a group of psychologists and social workers years ago. And a lady who'd been a therapist for 20 years, but didn't really understand addiction, came up to me in tears. And she said, I wish I had heard this 10 years ago. And she said, I got married when I was after college, and my husband and I loved each other. He was a great dad. We both drank, but he developed there was a point where his drinking got more and more and more and more, to the point where he actually died of liver disease secondary to alcoholism.
Lizard disease, yeah. Mm-hmm.
All of the above. We'll take that with dracunculiasis.
Yes. I have the young man that won the National Spelling Bee here to help us with some of the terms.
I know we're getting close to time. I want to just say a couple of things. First of all, we are going to come back at a later episode. We're going to talk about prevention. But to your point, John, by the time we are 18, studies show that we see 500,000 alcohol commercials. None of those alcohol commercials show people throwing up over the toilet. They all show people having a really good time. I wish people would see 500,000 commercials that help them understand what addiction is. Imagine the difference in how people view any type of addiction, much less alcohol addiction. If they saw that, it would be a game changer. The piece, though, I want people to leave with today is this triad. It's the triad. Yeah. And that is how Hanley Foundation is changing the way that we not only deliver treatment to those currently in the throes of some sort of substance use or mental health challenge, but this is how we're going to make sure that we break this cycle for the next generation. We're going to talk more about that later episodes, but I think the word that we want to use is we are disrupting this industry, and people are going to hear a lot more from Hanley.
Love it.
I love that as well. And it goes back to what you said earlier, the old joke, doctor, it hurts when I do this, don't do this. And you are absolutely right. Well, treating the disease of addiction, as we learned from Dr. Dyben and Dr. Docekal, it's not one size fits all.
It's the D's.
Join us on our next episode as we delve into the complexities of addiction treatment
Cory's
for unique demographics, older adults, pregnant women, first responders. I'm going to riff now. And what we're going to do is really get into this and create a greater understanding of addiction so that people can understand how to treat it, how it affects their relationships, their loved ones, and everyone in their community. Until next time, keep embracing your recovery. And as Rachel would say, thriving in your story.
Thanks, everyone.
Thank you.
Thank you for joining us for the Hanley Effect. To learn more about our programs, visit hanleyfoundation.org or call 844-502-4673.